Shall we say that it's a happy day for Thailand, Kuntepchai, because of the confirmed new cases? Today is the lowest since March the 15th, and the figure today is 15, the case of new infection.
Absolutely. I think we can call today another day of good news because we continue to see back-to-back days of a decline in the number of new infections. As Kunatha just mentioned, only 15 cases were reported today, the lowest in weeks. And what is equally encouraging is that the number of COVID-19 patients have also who have recovered has also been increasing steadily. So on two fronts, the number of new cases has been declining and the number of people who recover from the virus is increasing. So we have good news on both fronts, Kunata.
Yes, and Dr. Tawisin Wisanuyotin, during his press briefing today, he mentioned that Thai people should be proud of what the effort we have done together, especially in the past month, to fight this COVID-19 all together. But again, he told us that the guard still has to remain very high, Kuntepchai.
Yeah, we could say that we might have seen the worst of the pandemic, but it is certainly too premature to say that we are winning the battle against the virus. And as a spokesman of the CCSA, the Center Fighting the Virus, Dr. Tawisin said, we are not yet out of the woods. That means that we still have a lot of work to do, especially in complying with the strict social distancing measures. And as Kunnatha just mentioned, that despite some good news, it's unfortunate that there was one more fatality today. A 58-year-old woman, a housewife who had underlying conditions and who had been in contact with her daughter who was earlier infected. So our condolences to her family.
That's right. That's another loss of life in Thailand. And responding to the questions that tend to come up every day, whether the lowest or lower cases in Thailand, is that because we didn't do much testing. So today, Dr. Tawisin has specified and explained in more detail for all of us to detect the symptom, in which if we find that our body temperature is more than 37.5 Celsius degree, and then if we have symptoms like coughing, dry throat, and have some fever, just any symptom coming up, just go to see the doctor to have yourself tested. That would be the safest way to detect yourself and to observe your symptom, whether you are infected because of COVID-19. So that's what he tried to explain more for all of us to observe our body quite closely, Kuntepchai.
It's a question that Dr. Tawisin makes it a point to address every day. The question of the testing, of course, because there are critics out there who question whether or not testing that we have been doing is comprehensive enough or effective enough. Because there are people, some of them anyway, still have questioned about the reliability or credibility of the figures released by the Public Health Ministry as far as the number of new infections are concerned. So today again, Dr. Tawisin went at length to explain that the testing that the Public Health Ministry has been conducting has always been professionally done and is comprehensive enough to give us a good picture of what the situation is like. He said, even now, the testing still continues, and the good news is that we are able to develop locally test kits and can now be developed locally. And these kits have been distributed to over 100 medical facilities throughout the country, to which anyone can visit and ask for a medical checkup if they have the symptoms that they believe that show that they could be infected. They may have some symptoms that could make them have questions about whether or not they're physically okay and they need some medical checkup. So they can go to any of these medical facilities for a checkup for free. I mean, that's very important. That is unlike in many other countries where this kind of checkup requires, the payment. But here in Thailand, Dr. Thevisin insisted that everything will be done free on the basis that you are having your medical checkup on the basis of fears of being infected with the coronavirus.
And also, he also mentioned analytical studies of 542 confirmed cases show that it takes between 4 and 28 days for symptoms to develop. That's why this point we all have to be careful as well, because he has noted that there is a high risk of asymptomatic people passing the infection on to many others. It means that some of us perhaps have got symptoms of COVID-19, but it didn't show because it will take 4 to 28 days. And during this period can be quite risky period. And we may have spread the infection to others without knowing it. That's why we have to take good care of ourselves, keep social distancing, wash our hands, and stay away from the person next to us for 1 or 2 meters. That's the same precautions that we have been told time and again, Kun Thepchai.
Yeah, these are so-called common sense measures that we need to take seriously. I mean, washing your hand as frequently as you can, and keeping distance from other people, even people within your own family, especially if they are elderly people. But Kunatha, what another question that Dr. Thevisin also has to address every day is about whether or not or when all these stringent measures that have been imposed over the past 1 month or so will be eased or relaxed. And as we all know that the fewer the number of new infections, the bigger the call for these measures to be relaxed. And today, some of the opposition MPs have added their voice to the growing calls for the government to consider easing or lifting some of the measures, because they believe that these measures are hurting the economy and hurting the people, hurting their livelihood. Of course, we know that a lot of people have been rendered jobless or unemployed because of these measures. Restaurants have been closed, entertaining venues have been shuttered, and life is not normal anymore. So hundreds of thousands of people certainly are out of job. And these people are putting pressure on the politicians, to put pressure on the government to consider lifting or easing some of these measures as soon as possible. And of course, Dr. Thevisin did not rule out the possibility of these measures being relaxed. But again, he cautioned that any relaxing of these measures need to be done in phases. That means step by step, on a step-by-step basis. And he doesn't agree with the idea that all these measures should be lifted all at once, because he is afraid that that would open the door to a possible resurgence of the virus.
Yes, and we have heard many proposals from different groups of business activity, business group association, and some group of research think tank in Thailand to have their own proposal in a way of how Thailand should try to reopen the whole economy. But it's quite a dilemma, Kun Thepchai, because it has to be balanced between trying to curb the spread of coronavirus and then try to revive the economy again. So it's the dilemma still. And then if we take a look around the whole country, especially in the region in Southeast Asia, the number of cases in Singapore, Malaysia, Indonesia, and the Philippines are quite high, and it is calculated as one of the top in the world in terms of watching the whole region altogether. So that's why the Thai authority and public health officials need to think quite considerably how to make a decision to take step by step to ease the restriction. Not an easy solution at all.
Yeah, of course not. And the situations in our ASEAN neighboring countries, as Kunatha just mentioned, serve as a good reminder that if any premature decision is made in lifting or easing these measures, then instead of reopening the economy, we would end up inviting the virus to come back, and this time in a second wave, which could threaten to be even more destructive than the first one. But of course, sooner or later, and we hope that it will be sooner, the government will need to make a decision. And it's most likely that in its meeting next week, the cabinet will decide on this very crucial issue. And according to Dr. Thevisin today, I think we can guess that the government will somehow agree to some kind of some levels or some degrees of relaxation of these measures. And as Dr. Thevisin pointed out, it is most likely that provinces that have made continuous progress in containing the virus will be most likely among the provinces that will see early but gradual reopening of businesses and social activities. So Bangkok probably not in that category. Bangkok and some other major provinces which still have high numbers of infection cases probably need to wait a little longer before they can expect to see these stringent measures relaxed.
Yes, Kuntepchai. And yesterday, we finally saw an open letter from Prime Minister to business community in Thailand, especially to the top richest business people in Thailand. And the open letter also sent to business association, many groups in Thailand as well. And we got some feedback from those people who got this open letter. And mostly they are quite welcome and feel honored that they have been addressed the open letter directly to them. And they have got some proposal. For example, Kun Haro Link from B Grim Group, he said he would like to offer the suggestion that the whole country should move forward in taking reform for short term and long term in order to solve the economic structure after the COVID-19 crisis. So that is one feedback from billionaire of Thailand, Kuntepchai.
Now, judging from the reaction from many of these businessmen that we have talked to, I mean, the move by the Prime Minister inviting the ideas and cooperation from the private sector is very much welcome. This is certainly in big contrast to the earlier cynical reactions from many people who misinterpreted the Prime Minister's open letter as an invitation for financial contribution or financial help. But the Prime Minister makes it very clear in his open letter that what he needs, what he wants is ideas from these proprietors, these leading minds, these leading thinkers and businessmen as to how they can cooperate in helping the government to overcome this very critical issue. And judging from their reactions today, including Kun Supachai Jiravanont, the chief executive of Jaran Pokapan Group, I mean, today he praised the Prime Minister's move as something very smart. And he compared each of the major businesses that the Prime Minister is addressing as similar to a ministry in the government. So that means that now the Prime Minister has another 20 ministries at least to help him with ideas and cooperation in fighting this virus. So overall, I mean, the reaction from businessmen who have received the letters from the Prime Minister have been very positive.
That's quite a remarkable move and quite remarkable gesture from Prime Minister, because he said he'd like to listen and seek cooperation from different groups of stakeholders in Thai society. On top of business people, he also planned to meet with civil society, small and medium-sized business people, to try to listen. And he would like to hear their project, their proposal to revive their own business as well.